The last step is to operate the cow's feet area. The treatment head we choose is 2.0. Other treatment heads cannot be used. Open your hands and be sure to apply cold gel during operation. The thread should not be too close to the eyeball. Focus on the middle and move to both sides. Repeat several times after the operation. The second step is to push outwards. The last step is to strengthen. The mode energy is the same, based on the customer's acceptance range value. The mode we choose is the MP mode. There should be a lot of gel, and it must be close to the skin. Apply it downwards and slide it to bring the fat here, and so on. Strengthen is done in this way. In this area and this area, we operate 4.5, then 3.0, then 1.5. The treatment weight is the same. After we just used 3 treatment heads, we can choose our 360 treatment head handle. Make another enhanced mode. We choose a 4.5 treatment head. The energy is also adjusted from low to high. The customer accepts the range value. This needs to be controlled by the foot pedal to control the output. During operation, we use half circle, half circle. Be sure to remember to put cool gel, so that reaching this point, the second line must be close to the skin. The same is here too, just push up from the fat here. We can also slide treatments from here later. We push the cartridge from the inside out in the northern neighbor fold area, just like this. Repeat several times. This kind of droppy area on the face must be treated several times, like this. Here we are using a 4.5 cartridge in dot mode. We use the more intensive mode and 3.0 cartridge. We choose MP mode, and the energy is adjusted from the lowest. Operate as before. We must pay attention to being close to the skin during the operation. Next, we changed to 4.5 cartridge. Use the dot mode, adjusting the energy from the lowest and the start. During the treatment, we need to use enough cold gel and keep it close to the skin. Every time we complete a shot, we move about half a circle from bottom to top. After arriving here, we start the second treatment area. From here, after completing the first shot, move half a circle and be careful not to move too much. The third treatment area is also the same as before. After completing the 3 areas, we can use MP mode. We can use the sliding method to treat, still from bottom to top, and complete the treatment of 3 areas. Be sure to stick to the skin. We choose the 3.0 cartridge and install it. First, select dot mode. The operation method is the same as that of 3.5 cartridge. The last step, we use the 1.5 cartridge and install it. The operation is still the same as before. The energy is adjusted from the lowest. Body treatment. First, we draw an operating area map for the customer. We should note that the navel area is restricted area and cannot be treated. In addition, some clients who have an Kaiserman section must avoid treatment in this scar area. The method of drawing a line is, we draw a line in this area a finger's distance from the ribs downward. The second step is to select the cartridge according to the customer's obesity level. For customers who are obese, we choose cartridge with deeper penetration, such as 13. Before the operation, we put the gel on the client's abdomen, and there must be more gel. The third step is to use dot mode and adjust the energy. We start from the lowest energy and adjust it according to the range that the customer can accept. Adjust the energy that customer can accept. The fourth step is the operation method. We start from the bottom, just like stamping, and move slowly. Each area operates the same way. The fifth step, we use MP mode, and the operation method is the same. It's like stamping, but you cannot move it too much. We use this position as a starting point, use the sliding treatment method to the left, and slide the candle from the inside out. The sixth step, we ask the client to lie on his side and use this area as a starting point to treat it first with the stamping method and then with the sliding method. Next, we change to a 9.0 cartridge. The operation method is the same as the 13.0 cartridge. Finally, after completing the operation of the 9.0 cartridge, we change the cartridge to a 6.0 cartridge. The operation method is exactly the same as 13 and 9.